when I heard about the incontinence, I couldn't believe that I could be in a situation wherein I might wet myself. Hi, I'm Martin. My journey with prostate cancer started after routine examination with my wonderful GP. In my case, after biopsies and MRIs, it was shown to be quite an aggressive cancer. So from that date, we have been through the follow-up to prostatectomy. The symptoms of prostate cancer are very minimal beforehand. Afterwards is when you really strike the symptoms of the condition. Everybody's journey will be different, and no matter how good the surgeon is, no matter how good the psychologist is, if you're seeing one at that stage, no one can be totally prescriptive in how things are going to progress for you. Where mine's taken me to now is we want to help others as to what might be your outcome, tools you can use to help yourself go through the path. And in my case, it's a year in, and hopefully I've got many more to go after this. It's something that was probably a big personal affront to me, that I would not be able to control something I've controlled all my life since being a toddler. I also had this great fear of becoming literally a dirty old man, smelly old man. But there's no way around it. It was explained to me that for a period of time, you are going to have continence problems. In my case, I had some surgical complications. I had to be recatheterized, so I got a double dose of the problems. Some men have very few problems. One of my friends was continent fully after 3 months. In my case, I'm almost there after 12 months, so don't get distressed. The person who explained it best was not actually the surgeon, but was the incontinence physiotherapist, who was just wonderful in just guiding me through what to do, how to develop the muscles that control your pelvic floor. And in blokes, we don't realise we've got pelvic floor muscles. Boy, we do. And they are so important. Some simple things where you cannot get advice. I'm going to show something that no man has seen until you have a prostate removal done. And that's an incontinence pad. I'll open one up. So that's what you're going to be confronted with. But you're probably going to need that during the first month or maybe 2 months. And that even does fit inside a normal pair of men's undies, jocks, and I wear jeans that are half a size too small for me all the time, and it fits inside there without being too noticeable. But the good news is, later in your journey, you go down to this cute little number. Much smaller, much thinner, and much more comfortable to wear with any type of trousers or whatever. When you're at the final stages of controlling incontinence, very discreet, same colour as most men's undies. It fits in the little bit of sticky tape with all of these. You just peel off at the beginning and that sticks to your jock so it doesn't drop on the floor. My other great fear that I'll be leaving a trail or something, behind. No, that will be your best friend at the later stages when you are getting over it. So there's a solution. You just get used to it. How simple can wearing something like that be?